Hi everyone! In this video we're going to talk about returning to running in the postnatal period. For more of a discussion about returning to exercise earlier on, a more of the low impact exercise, check out my other video on this topic. And again, I'll remind you that this is not intended to be personal medical advice. And in fact, there is strong research evidence supporting individual assessment and treatment of the pelvic floor after giving birth. So I absolutely encourage that for more specific guidance in these matters. I decided to talk about running separately because there are specific demands that running and high impact exercise has compared to other types of activity. For example, running has been associated with a rise in intra-abdominal pressure, and there are high ground reaction forces associated with running. So basically what that means is there's extra pressure internally and pressure coming from the outside, and both of those forces can really impact the pelvic floor, the abdominal wall, and other parts of the body. The time-based recommendation for returning to running is to wait a minimum of 3 months postpartum. And that's based on anatomical changes that are common in pregnancy and birth, as well as the physiological healing times associated with those changes. For example, the levator hiatus, which is basically an opening in the pelvic floor to allow the urethra, the vagina, and the rectum to pass through, that area widens with pregnancy, and then especially after a vaginal delivery. And an increased levator hiatus is associated with an increased risk of pelvic organ prolapse. Also, with vaginal births, there is often increased bladder neck mobility, which can be correlated with an increased risk of stress urinary incontinence. And both of those things, the recovery is maximized within the first 6 months postpartum, so you just want to allow some time for that to take place. Similarly, there are changes with a cesarean section. So you want to be mindful that you're giving the uterine scar enough time to heal and start to remodel. And studies have shown that the abdominal fascia only has about 50 or 60% of its maximum tensile strength back at 6 weeks postpartum. And you really want good tensile strength and stability there before you think about getting back to high impact exercise. And so some of those changes is where that 3-month baseline recommendation comes from. But that is just a starting point, so there are other factors that may extend that even further. If there are signs or symptoms of dysfunction, it may be worth waiting even more. So some of those things to look out for include any feelings of pressure or heaviness in the pelvis, any urinary or fecal incontinence, pain, whether that's pelvic pain or low back pain or other musculoskeletal pain, and presence of any vaginal bleeding that's not associated with the menstrual cycle. All of those things would be worth looking into and getting addressed before even considering a return to run program. Then once those factors are met, it's still a good idea in the ideal world to get an objective assessment as well, looking at, does the pelvic floor have adequate strength, endurance, and coordination to handle running? What are the other muscles doing, and are they ready? Is pressure being managed properly and load being transferred properly, and all of those things, just to see, is the body working as a whole, and is it going to be supported enough to get back to the physically demanding activity of running? And then finally, just something to keep in mind in the background of all of this are our personal factors that can influence healing, recovery, and just readiness to return to running. Some of those things include, what was your fitness level pre-pregnancy or pre-birth? Are you breastfeeding? Because breastfeeding really changes hormones up to 3 months after you stop breastfeeding. Those hormones are different than normal, and that can change tissue quality. Sleep, nutrition, is there a diastasis recti present, that abdominal separation? Even things down to, are you planning on using a stroller? Because that is extra effort and changes the body mechanics a little bit of running. So keeping all of those things in mind. And then once you've established that it is appropriate to return to running, It's encouraged to really take a graded approach and start with small goals, start easy, and gradually increase your overall goal. So I know what I just laid out and the guideline to wait 3 to 6 months or maybe even longer before returning to running can be pretty disheartening for new moms. And I just want to say that I get it. In fact, one of the reasons that I became a physical therapist was that way back when I was a patient, I was just told, you'll be fine if you just give up the one thing that you love. And I didn't like that very much. And I don't want other people to feel that way either. And it really comes down to weighing risk versus reward. So if running or some other type of exercise is the one thing that makes you feel like yourself or is giving you that sanity that you're craving, I get it. But I do encourage you to look at both the short and long-term consequences. And if you already have a baby especially, you probably know that time flies, and so maybe waiting a few extra months in the scheme of things is worth it if it means less pain, less functional problems down the road. So it's just something to consider.